There are large racial disparities when it comes to who is getting the COVID vaccine. In Baltimore, Maryland, African Americans make up more than 62% of the population, but only about 32% of the vaccinations there have been administered to the black community. Our national correspondent Jericka Duncan takes a look at the barriers to vaccine equality in some of Baltimore's most vulnerable neighborhoods.
Thank you for wearing your mask, for keeping your distance.
That's the voice of Kobe Little. He drives this truck through Baltimore, educating vulnerable communities on the coronavirus and now the vaccine rollout. Little is president of the Baltimore City NAACP. He says policymakers and healthcare providers are overlooking the needs of the black community.
And I'll give you an example. In this phased rollout, one phase is for seniors 75 and above. In Baltimore City, the life expectancy of an African-American man does not reach 75.
This is not unique to Baltimore.
There are several factors contributing to vaccine inequity, says Mark Martin. He is Maryland's deputy director for the Office of Minority Health and Health Disparities.
I hear you say hesitancy and access are big issues when it comes to vaccinating the most vulnerable populations of people. But we spoke to a 62-year-old woman from Baltimore.
And I haven't been notified to take my shot yet, but I'm waiting.
Who said she registered at 3 different locations 2 months ago to get this vaccine, and she hasn't received it yet.
We continue to work through the registration process. Again, one of the things that we try to do is just stand up these vaccination sites as quickly as possible.
In addition to expanding vaccination sites, Martin says the state is turning to churches for help.
We are not prepared to fight a virus that is killing persons.
Churches like New Psalmist Baptist, where Pastor Walter Thomas says it's not just about saving souls, it's about saving lives. He wants to turn his church into a vaccination site.
Do you think it's more of a problem of vaccine hesitancy or not having the access at this point?
I think it's both. I think it's an information problem, and I think it's a logistics problem. People don't understand. You don't have CVS stores and Giants and markets all over large sections of certain African-American communities. They don't exist.
So how does that translate into not being able to get a vaccine?
It all flows down because the economic infrastructure to build those persons up doesn't exist. So half of them don't have cars.
Martin says the health department's next step is bringing mobile vaccine units into the heart of the communities that need them the most.
How soon do you think that could realistically happen?
As soon as possible. Again,
what does that mean? 2 weeks, 3 weeks, 2 months?
Hopefully within the next couple of months, for sure.
The city's health department, as you heard, could not give us a timeline. As they say, it really depends on when those doses come in. Now, as for access, the state health department just recently, as of last week, opened up a call center, making it easier for people to register to get that vaccine by phone instead of online. Tony?
As the report shows, there are decades of disadvantage, and you're not going to fix that in just a number of days. Jericka, thank you very much, but we have to try, of course.